Contact lens disinfection can be achieved through proper use of multi-purpose lens care solutions, many of which contain the preservative PHMB. For more than 2 decades, PHMB has provided safe and effective lens disinfection for millions of patients. Like all other MPS preservatives, PHMB can adhere to any lens material during the soak. After application, the lens releases the preservative into the tear film at a rate that can vary depending on the lens material. At the corneal epithelium, some of this preservative may be present until cleared over time with normal tear flow exchange. With the lens removed, if sodium fluorescein testing is performed in the presence of PHMB at a time of peak preservative release from the lens material, it can produce a superficial micropunctate fluorescence pattern. This preservative-associated transient hyperfluorescence, or PATH, is a temporarily observed phenomenon, distinct from clinically meaningful corneal staining. It does not indicate corneal inflammation, damage, or risk for infection. Instead, this transient hyperfluorescence results from fluorescein preferentially binding to PHMB molecules in the local environment before their eventual clearance. Laboratory studies indicate that the release of PHMB from plasma-treated Cy-Hi lenses like Balafil-Con A peaks within 2 hours of lens insertion. Not surprisingly, fluorescein testing performed at the time of peak PHMB release produces the most intense PATH phenomenon, which can falsely suggest corneal injury. PATH intensity diminishes for fluorescein tests performed subsequent to peak PHMB release. The PATH phenomenon neither signifies nor contributes to any proven harm to your patient's eyes.